Good afternoon, students. The properties again related to the mechanism of respiration we are going to discuss. As these properties are different properties which are going to affect the mechanism of respiration, I have divided these sessions into smaller sessions, but each one of this is very important session. Many a times each one will be having a small answer question, a short answer question, or it can be asked as a part of long answer question. So all of these factors are very much important as far as exam is considered. But for your understanding of the respiratory physiology and the respiratory medicine, of course, they are lifetime important. So we are going to consider in this particular session the resistance to breathing and the factors which are causing the resistance to breathing. Due to that, the work of breathing what normally has to be performed by the respiratory system. So we are going to discuss these factors. Just the revision of normal breathing. What does normal breathing? It is due to active contraction of the inspiratory muscles, which causes the enlargement of the thorax. Due to enlargement of the thorax, it lowers the intrathoracic and intrapulmonary pressure. Now, along with the enlargement of the thorax, this active contraction of the inspiratory muscle also enlarges the alveoli, the bronchioles, and the bronchi. And as the volume is more, it lowers the alveolar pressure below the atmospheric pressure. So that is the first change which occurs in cases of normal breathing. And due to these pressure changes, the air is flowing from mouth and nose to alveoli. Now these inspiratory muscles, which are the active muscles, they provide the force which is necessary to overcome. Why it actually requires to have the inspiratory muscle contraction. Why it is not the passive process. Why? Because they have to overcome the elastic recoil of the lungs and chest wall, and secondly, the frictional resistance. So these are the two important factors which causes the active contraction of the inspiratory muscle requirement. So the contraction is very much required to overcome these elastic recoil plus the frictional resistance. Now this frictional resistance is caused by the lung tissue and the thoracic cage, that is tissue resistance, and second is the airflow in the conducting airway which offers the resistance. So airway resistance itself and the tissue resistance itself is combinedly causing the frictional resistance to the normal breathing. Along with that, the most important factor is elastic recoil also. So this is the just to have an idea regarding this is the normal process and these are the normal resistances which are occurring to the airflow. Now this resistance to breathing is elastic resistance is around 65% is due to the elastic tissue of the lungs and the thoracic wall. And the 35% remaining resistance is due to the non-elastic resistance, the non-elastic properties of the respiratory system. And in these non-elastic resistance, airflow is offering the most of the resistance, that is around 80%, and viscous tissue is offering very less, that is 20% resistance to breathing. So on an average, you have two types of resistances. One is given due to elastic tissues. So that is the most important. So it has to overcome this elastic resistance around 65%. Remaining is due to non-elastic structures, that is around 35%. And amongst these non-elastic resistance, airflow is a major factor which contributes around 80%. Now coming to the elastic resistance. This elastic resistance is mostly due to the elastic recoil of the lungs. So that is the tendency of the elastic lung tissue to recoil from the chest wall. So always whenever the inflation is occurring, again there will be a tendency of this elastic lung tissue to recoil back. And to overcome this recoil is the resistance during the mechanism of breathing. And the second important factor which it has to overcome is the surface tension process, which already I have discussed in a separate session. The lung elastance is the measure of the work that has to be exerted by the muscles of inspiration to expand the lungs. So these muscles has to work more to expand the lungs. That increased elastance is needed to counteract by increased power of muscles of inspiration. So if increased elastance is needed, you have to increase more power of the muscles of inspiration, and that can lead to increased work of breathing. So whenever you require increased elastance, it has to overcome. Say for example, the elastic tissue is damaged, then you require the increased elastance or power, and this power is generated by increased power of the muscles of inspiration. And if you are overactive muscles of inspiration, that can have increased work of breathing. The work of breathing is a physical work that have to be carried out by the muscles of respiration to overcome this elastic resistance of the respiratory system and the non-elastic resistance of the airways. So continuously throughout the life, you are doing this work of breathing. Unknowingly, unconsciously, all of your muscles of respirations, they are working to overcome this elastic resistance along with the non-elastic resistance of the airways. So this you have to always keep in mind, and that is why the power of muscle, like you keep your active muscle activity by doing different type of exercises, it is safe to have the breathing exercises also, and to keep your respiratory muscles also powerful, you have different breathing exercises. And you know that different sports also routinely also nowadays do this improvement because the improvement in activity of these respiratory muscles. The factors which are affecting the elastance of the respiratory system are a number of factors. The elastance of the whole respiratory system depends on elastance of both the chest wall also and the lungs also. So whatever factor which are affecting the lung elasticity or the chest wall elasticity definitely are going to affect the elastance of respiratory system. They have a serial relationship in forming the respiratory system. So the elastance of the whole respiratory system can be calculated by the addition of these two because they are in serial relationship. The elastance in each of the lungs and the chest wall is approximately 5 centimeters of water. So whole of the elastance of the respiratory system will be double of that, that is around 10 centimeters of water pressure. So it has to overcome, see the power of the muscle, it has to overcome this much of resistance. These variations in the elastance of the respiratory system are mainly due to the alteration in the elastance of the lungs. And as now, up till now, you might be knowing that the lung elastance is governed by two main factors: the elastic recoil forces of the lung tissue and the forces which are exerted by surface tension at the air alveolar intervals. So, if any change at the surface tension level or any change at the elastic recoil forces in the lung tissue itself is going to affect the elastance of the whole of the respiratory system. And different disorders which are causing, say for example, you have ARDS, say for example, you have fibrosis, all these factors are going to affect the lung elastance. So this you have to keep in mind that these are the elastic forces. Now, as the lectures or sessions will go on, we are going to study at the end of these respiratory session, if the time permits, different diseases also. And in that, you have to make sure that what are the physiological changes which are occurring in these particular type of disorders. So, in this particular session, I am going to discuss only the factors which are physical factors which are going to affect the mechanism of respiration. So the remaining part of light part in the at the end of this respiratory session lectures I'm going to discuss. Now next important resistance which we are going to discuss in the session is airway resistance, again which is very important factor. There is airflow which is occurring in the airways. You know that there are generations of airways and the air is flowing from mouth to alveoli. Now, two types of airflow that can occur in the lungs. Actually, they can occur in any tube-like structure So they are laminar flow and the turbulent flow. What is laminar flow? Whenever the flow is streamlined, that it is a very slow, a laminar flow is occurring. This is silent because the layers of air molecules slide over each other. So it is slow and it is streamlined, and this is commonly seen in small peripheral areas. So here, if you are looking for the airflow in the small peripheral areas, it is always laminar airflow. You can have turbulent flow when the flow occurs at high flow rates. This is normally observed in large areas. For example, in trachea and large bronchi. It consists of a disorganized pattern of airflow that produces sound. So if you're doing fast and deep breathing, the sound is heard both in inspiration and expiration. So in larger airways, you have the high flow rate. Due to that, you get a turbulent airflow. Whereas in small airways, you get streamlined slow flow, and that is known as laminar flow. You can, if you're doing the clinical examination of respiratory system, you see the examination is one of the examination which is done on examination of sounds, breath sounds. So you have to keep the stethoscope on the trachea and the bronchi. If you're keeping the stethoscope, you can hear the large airflow. So these are the large airways, and you can listen the sounds due to turbulence. So this is airflow types normally present in the lung airways. Now, what is airway resistance? The airflow, it is maybe streamlined, maybe laminar, or maybe turbulent, but there may be resistance which is offered to the movement of air. And this airflow is defined as the ratio of driving pressure to airflow. So it will be having a resistance to reach up to the level of alveoli. And as we are concerned that there should be reaching of normal amount of gases till alveoli to cause the normal diffusion, then it is very much important. If the resistance is much more, the normal amount of air will not reach to alveoli. So these factors again are very much important. This airway resistance, which is denoted as RAW, is expressed in centimeters of water per liter per second. For total airway resistance, the driving pressure is the pressure difference between the mouth pressure and the alveolar pressure. So this will be the driving pressure, and by which you can find out the airway resistance. It is a highly sophisticated investigation which is performed in different types of pulmonologists. So this is the site of generation of airway resistance in airways. Now we can see that there is a highest resistance which is offered by the segmental bronchi. So you have the resistance on the vertical axis and you have the generations of airways on the horizontal axis. So you have conducting airways and you have the respiratory airways. The respiratory airways will be 16th generation onwards, whereas before that it is only conducting airways. And this is the largest area where you get the resistance of airways. And you can see that at the segmental type of bronchi, that is up to 8 generations, the highest resistance is offered. So you have to be make sure as a doctor, see if a person comes to you, you have to find out what is the problem and where exactly the resistance is there and what are the factors which are going to relieve this resistance. So this you have to keep in mind. Now let us come to the factors which are affecting this airway resistance. So of course, the first and the most important factor will be diameter of airways. The second important factor will be the volume of the lung. The bronchodilation will decrease the resistance, whereas whenever there is constriction of the bronchi, it increases the resistance. So definitely the diameters of the airways from 0 to 24, we have 23 generations, you have to maintain the diameter. If there is any disorder which is causing the change in the diameter, that will change the resistance. The second important factor is lung volume. It is among the major factors which is affecting the airway resistance because the caliber of the airways is directly proportional to the lung volume. The bronchi and the small airways are embedded in the lung tissue. So the airway diameter increases along with the lung expansion. So you see the structure, functional structure of the lungs and the airways also. These bronchus and the small airways, they will be embedded in the lung tissue. So whenever the lung expansion is occurred, these airways also will be increasing in diameter, and that will cause the decrease in the resistance. Thus, airway resistance is decreasing during inspiration whenever the lung expansion is occurring, and it increases during the expiration whenever the lung is again recoiling back, because the bronchi and the small airways are embedded in the lung tissue. So these small factors are going to affect the airway resistance. So this is a relation of airway resistance with the lung volumes. This is a figure from Brighton. So you can see this, that low lung volumes, the resistance is more, whereas at higher lung volumes, the resistance is low. So that during inspiration it is, and during expiration what it is. So you can find out the relation of this. The third important factor, the first was diameter, the second was the lung volume, and the third important factor is bronchial smooth muscle tone. Now, this smooth muscle, as you know, structurally the bronchi will be having the smooth muscle and they will be innervated. And the activity of different factors which also causes the contraction of smooth muscle or dilatation of the smooth muscle, which is present in the bronchi. So the third important factor is bronchial smooth muscle tone. And this bronchial smooth muscle tone is affected by various factors. The most important factor is autonomic control. As we have already discussed, again there is a repetition here that parasympathetic stimulation causes the bronchial constriction. Sympathetic stimulation causes the bronchodilation. So it is going to affect the resistance. There is also a non-cholinergic, non-adrenergic innervation, which causes the dilatation of the bronchi. So these are the autonomic control that will change the diameter of the bronchi and the airways, affecting the resistance. It is also affected by some humoral factors like local hormones, epinephrine, norepinephrine, histamine, that will be released at the level of airways. If it is epinephrine, norepinephrine, it can cause bronchodilation, and histamine is generally causing the constriction of the alveolar airways, and it increases the airway resistance. The smooth muscle tone is also affected by drugs such as isoproterenol, which produces the bronchodilation. Now, these important factors which you are going to study in detail in second year, because you know that this is how the dilatation, bronchial smooth muscle tone is maintained. Now, the drugs which are causing constriction, you have to study. The drugs which are causing bronchodilation, you have to study, but this factor will be considered in your second year pharmacology lectures. So suppose I'm giving an example, that is asthma where you have the constriction. Now here you know that there is a constriction, so you have to give the drugs which are causing bronchodilation. That will decrease the airway resistance. So very easily the process of respiration can occur with less resistance. Then environmental factors, they also play an important role on the bronchial smooth muscle, like breathing chemical irritant, dust, smoke, that causes reflex constriction of the airways, generally through the vagus nerve. And these irritants cause the bronchoconstriction. So these environmental factors you have to keep in mind. Increased PCO, partial pressure of carbon dioxide, that also causes local bronchodilation. So it is going to affect the airway resistance. So that is the third important factor which is affecting the airway resistance. Diameter first, second is lung volume, third is bronchial smooth muscle tone. And the fourth important factor which is affecting the airway resistance is viscosity and density of inspired gas. So you know that these gas properties, which from the outside, you are allowing these gases to go inside your body. Now this will change, the gas will change its property, and this again you have to keep in mind. The viscosity of the gas and the density of the inspired gas, always you have to keep in mind. Why this is important? Because increase in the gas density, suppose normally occurs in deep sea divers, which increases the airway viscosity. The air density increases due to increased barometric pressure. So as you go down deep inside the subatmospheric pressure, deep under the sea, the barometric pressure increases, and due to that, the increased barometric pressure, the density of the air is increased. And this increased density can cause the airway to become increased viscosity. And due to that, a gas mixture is given which is having a low density, that is oxygen helium gas mixture. And this is often used during the dive to make the breathing easier. So these are the physical factors due to which the development, you must have seen that the divers they use the cylinders, and this cylinder is not having only oxygen, it is a mixture of oxygen and helium to reduce the density of the inspired gas, because we don't want the increased barometric pressure. Of course, again, these deep sea diving and decompression sickness, a separate session is there. Then again, we are going to discuss in detail. So this oxygen helium mixture can also be used in the treatment of status asthmaticus. So here a constriction is occurring, there is difficulty of the breathing, and in these patients, the asthma patient, a condition can occur, a serious condition which is known as status asthmaticus. In that, we can use the oxygen helium mixture. So here the low density of gas will be allowed to enter inside the body. So that also affects the airway resistance. The fifth is phases of respiration. So the airway resistance will be different in different phases of respiration. Actually, it is not altered during the quiet breathing, but during the forced expiration, as in cases of severe exercise, the resistance is significantly increased. So generally the resistance will be same in every phase of cycle if you are doing quiet breathing, but it will be changed during forced expiration, and that again you have to keep in mind. This high resistance is associated with decreased expiratory flow. The marked increase in resistance during forced expiration occurs due to compression areas. So whenever there is a resistance which is offered, that occurs due to compression of the airways. So when if you are doing forced expiration, as in severe exercises, there will be airway compression, and that can lead to increase in the resistance. So this is a recording which is flow volume curve during forced expiration. We can see if it is a normal breathing, it will be a smaller loop like this. But if it is a forceful inspiration, see there is a forced inspiration here, the peak is there, and then slowly it will be expiring out. And this complete inspiration process depends on the effort. Effort is how well your inspiratory effort is there. So you can increase by effort the inspiration. You can train your muscles and you can inspiratory muscles, and you can increase this inspiration process. After it reaches at the level of this total lung capacity, then the phase of expiration will start. So here again the expiration will be up to the peak expiration, it will be by the effort. So you can voluntarily add up the volume. But after the reaching of this peak expiratory flow, this will be without effort. So you don't have the control, it will be forced expiration. So this is forced expiration. And most of the time, this resistance is which you have to keep in mind is during these phases of expiration. So this can occur, it can change during these phases. So this is just the explanation of the previous figure. A small loop is seen during tidal breathing, whereas a large loop is observed during the forced breathing. During forced inspiration, the inspiratory flow is limited only by effort. So if you stop activity of your respiratory muscles, the inspiration will be stopped. But if you are motivating, then the inspiration can be much more, the forced inspiration. That means the force with which the individual inspires. But during forced expiration, the flow rises sharply to a peak flow and then decreases slowly. And the first phase of this is dependent on effort, as I have already told, till the peak expiratory flow. Then it becomes independent of effort. And during this post expiration, the flow, mostly the flow is independent of effort. And this indicates that the dynamic airway compression during the expiration. So suppose this part of the most of the respiratory disorders, they will cause the compression of the airways, and if this compression is occurring, it is going to affect the part of expiration. It is not going to affect the part of inspiration, because inspiration is limited only by the effort. So if you are increasing the effort, it will be again normal. But expiration mostly is independent of effort, and it depends on the airways. So if there is a compression, it is going to affect the process of expiration. So dynamic airway compression increases the resistance, which effectively limits the expiratory flow, and it is going to affect the resistance also, and it is going to affect the factors also. So in summary, what we have seen is the factors which are affecting the airway resistance, which are very, very important. Like these are the factors, the 5 important factors we have discussed. The first important factor is diameter. Second important factor is lung volume. The third important factor is bronchial smooth muscle tone, which is affected by various factors. The fourth important factor is viscosity and density of the inspired gas, which you have to see carefully. And the fifth important factor is phases of respiration. But again, in not in quiet breathing, in the forceful respiration, you have to keep in mind that the resistance is going to affect in these phases of respiration. So I think that is all regarding the resistances which are offered at the level and causing the breathing work to occur. And this you have to consider, because this is going to affect the mechanism of respiration. Thank you very much.